Hi, good day to everyone. My name is Hannah Watson, and welcome to our session today on statistical analysis plans. I have the pleasure of presenting this session. And for fun, while attendees might still be joining or changing Zoom rooms, I thought that we could start with a couple of polls. So you can join the poll in three ways. You can scan the QR code with your phone. You can visit menti.com and enter the 8-digit code at the top of the slide, or you can click on a participation link without a code in the chat. And while you're completing the poll, I'll share some background information about myself. So I'm a research associate professor at the University of North Carolina at Chapel Hill in the United States. And my research has predominantly focused on eating disorders. And I've had the privilege of authoring over 100 research papers on eating disorders and serving on the editorial board of the International Journal of Eating Disorders. I have worked in various roles over 2 decades as a research psychologist and a biostatistician in healthcare, government, nonprofit, and academic sectors. And I've had extensive experience preparing statistical analysis plans. So here we can see on the poll, we've got a mix of results with 33% very familiar, 17% somewhat familiar, and 50% are not familiar at all. Okay, moving to the next poll. The question is, do you currently use SAPs in your research projects? So today I'm delighted to share with you an overview of SAPs and practical guidance for writing them. They're an important practice in enhancing research rigor. So my talk will introduce SAPs and also share a template that I've developed to help write them. We can see here that about 60% of attendees regularly use statistical analysis plans, and then there's quite a mix with the other response options. And so, as well as sharing practical guidance, I will also overview the benefits and challenges and talk about the current landscape and future outlook. So what is a statistical analysis plan? It's a document that outlines in detail the statistical methods and procedures that will be used in a study to analyze data. So essentially, it's a blueprint for the analyses that will be conducted, and it can enhance transparency and reproducibility of research. So historically, researchers used to conduct research with a lot more flexibility and potentially bias in their analyses, which has spurred an interest in more open and rigorous scientific practices. SAPs are currently the exception rather than the norm. So I've developed a user-friendly SAP template. It's tailored for observational studies and for a range of audiences, including non-statisticians, but other individuals who may be analyzing data in studies, including students who are conducting dissertation projects. And I've provided the link to access the template here, and it can also be accessed through the QR code. The template includes notes for its implementation. And in the next section, I'll be walking through the template, which essentially outlines the key structure and items that one could include in a statistical analysis plan. And I'll also be sharing examples from real studies that I've worked on recently. So while I won't have time for an in-depth review of each example, I aim to give you a clear overview. So section 1 of a statistical analysis plan contains the administrative information, and recommended items to include the study title, information about the study registration, its number and the platform it's registered on, if applicable, information about roles and responsibilities, and another recommended section is for signatures. These fields can be customized to the context. So, for example, in our internal SAPs in the lab that I work within, we often include other fields such as the timeline, We'll include the co-author names and affiliations, ORCID IDs. We also often include a section or a field for the journal we intend to submit to, with potential journals ranked by impact factor. At the end of this section, it's helpful to include a list of abbreviations. The next section outlines the study's background and rationale and presents the aims, the research objectives, and the hypotheses. And pre-specifying this information helps to safeguard against bias. So, for example, data phishing or p-hacking or harking. And harking is an acronym. The HARK stands for hypothesizing after the results are known. And here are some examples of how these sections were laid out in real SAPs. You can see in this example, the aims, the objectives, and hypotheses are presented in a table format to help improve the clarity. And each research objective specifies in more detail how the aim of the study will be carried out, with a hypothesis linked to each research objective. Study 3 details the study methods, including the study design, the study population, inclusion and exclusion criteria, information about the recruitment for the study, and the data sources, if applicable. And this information is commonly also included in the study protocol. The reason it's included here is to give some additional context for the study, so that when the statistical analysis plan is being circulated for comment amongst co-authors, students who might be being onboarded to the research project, to the biostatisticians who might be being onboarded, they can understand the design of the study and have some context for the types of analyses that might be possible. So data sources, that refers to if a study, for instance, has used register data, it might refer to specific registers. It might, for secondary analyses, refer to the parent study. It might also refer to biobanks or the versions of the quality assured data files that are used. And in this section, the fields can be customized to the context. As we see here, we had some other comparison cohorts, an OCD cohort and some healthy control cohorts that were being included in our study as well from other sources. The next section presents the measures and the variables, and it's recommended to use subheadings customized to the study to describe the measures and variables that will be used in the study. So these are some example subheadings to consider. These would be tailored to perhaps the study design, the discipline, or even the analysis approach to be used. In this section, we would also include the timing of the assessments, and we'd provide sufficient detail about each measure. For example, how the measure was scored, the subscales used, the citation to the paper that developed the measure, and so forth. And it's also common in statistical analysis plans to include a table of variables. So, for example, in a data dictionary format, so that the readers can see how each variable was derived, if it was derived from the raw data. And the idea behind this section is to include enough detail so that an independent data analyst could potentially reproduce the main variables used in the study if they would be given the raw data. So you can see this pre-specification helps to prevent against bias and the potential for researchers to selectively report on different variables, to change their primary variables before the study, during the study, and so on. So section 5 is really the core of the SAP and the bread and butter of our work as statisticians. And this presents the statistical analysis. It pre-specifies how each hypothesis will be tested, ensuring that the analyses are reproducible. And recommended items to include in this section are how the sample size was selected, including the power calculation, if one was performed, what the primary analyses are. So specifically, in my own statistical analysis plans, I like to link these back clearly to the specific objectives that were laid out in the introduction. This section will also include whether there were any sensitivity analyses planned, how missing data will be handled, and the analysis populations that will be included. And one of the reasons that we cover the analysis populations is that this helps prevent against bias, including selective reporting, where researchers could explore their data in different subgroups in the data, different age groups, and so on, until perhaps a significant p-value was detected, and then report only that result, so losing the context for the rest of the data. So in the analysis populations, we might specify the subgroups to be analysed and any strata. And then another item to include is the confidence intervals that will be reported and the p-threshold that will be used to evaluate the significance of the findings. In this section, it's also important to outline whether any procedures will be implemented to correct for multiple testing. And section 6 includes information about pre-registration and study reporting. This is not routinely seen in SAPs, but it is consistent with best practice. So in line with current best practices, I incorporate this into the template that I use within my lab. So this includes whether the SAP itself will be pre-registered, and also information about how the study will be reported. So if any particular guidelines will be used, such as you may have heard of STROBE, the STROBE guidelines for observational studies, or the CONSORT guidelines for clinical trials. And so I like to include this information here to prompt the PI to think about these issues and prompt trainees to think about how they will be presenting their results. Many of the items in these guidelines pertain to statistical procedures and considerations. So it's really important to pre-specify these in advance rather than once one gets to reporting the paper and then realizes as they're going through the checklist that they haven't actually addressed some particular items that are recommended to report. Section 7 includes a revision history. So I suggest to put this in a table format with the version number of the SAP, the date, any comments about any particular changes that were made to the SAP, and also the timing of the revisions in relation to key milestones of the study. And I do include some more extensive examples of revisions and how to fill out this particular table in the template. And the reason this information is good to include is for transparency, to understand was the statistical analysis changed, after seeing the results and the researcher having access to the data? Was it changed because a peer reviewer asked for different changes after the manuscript was submitted, and so on? And then the last section is to include citations used in the SAP. So moving now to some practical guidance for writing SAPs. They're a collaborative effort. They're developed by the statistician in consultation with the PI or the lead author of a particular study, and also in consultation with the research team. So in my own practice, I will work with the lead author of the study, and we will develop the SAP, and also sometimes a core research team if there's 3 or 4 of us, doing the day-to-day work on the project. And then I will also loop in the research team members, such as the site PIs at other sites we may have globally, any analysts at their sites who will be carrying out data analysis at their site, and any other co-authors, and we'll review the stat plan we will meet about it, and I'll present it, we'll discuss it. So it really is a collaborative effort, and this helps to ensure that the analyses will be addressing, the clinical or the research questions that really matter to the team that has the substantive knowledge of the topic. It can also be helpful. In terms of guidance and templates, there is some public guidance available. It is very limited. There's surprisingly not much information on how to write and develop SAPs, and no particular standards. For clinical trials, Gamble and colleagues, they consulted a wide range of stakeholders, and they used a Delphi consensus methodology to develop a minimum set of recommended items. And that those recommended items have had some success in adoption. Hiemstra and co-authors and Yuan and co-authors appraised those items for their applicability to observational studies. They may lack some user-friendliness, particularly for non-statisticians who may be analysing data, and it may lack some applicability as well to some settings. So I also recommend consulting published guidelines for planning and reporting studies. So for example, for observational studies, these are some common guidelines. I've included more in the appendix of the slides, which are available through a QR code I'll show at the end of the presentation. As well as this, one can find examples. There's, I think there's more than 10,000 examples of observational studies registered on clinicaltrials.gov. So it's not only a platform for registering clinical trials, observational studies are also being registered there. Increasingly, the Open Science Framework is being used to register study protocols and statistical analysis plans. More examples can be found through basic internet searches, and also stat plans are published in the scholarly literature as well. In line with current best practice, it's not always feasible and it's not always common for observational study designs to be pre-registered, but it is considered best practice. And registration platforms include OSF, clinicaltrials.gov, and aspredicted.org. So I'd like to share another poll question with you. And you can enter the poll as before through the QR code, through going to menti.com and entering the 8-digit code, or on the link that was posted earlier in this presentation. So the poll question asks, what kind of support or resources would help you use SAPs more effectively? So when you reflect on SAPs, would workshops or training sessions be most helpful to you? Would templates and examples offer more value? What about access to guidelines or peer mentorship? Okay. All right, so we can see quite a range of responses there, with templates and examples being perhaps the most helpful support or resources. Now, I would have to agree with that. That's what I have looked for too, for examples in constructing my own SAPs and in thinking about this more in depth when presenting training to students. Okay, so let's turn to a brief consideration of the benefits and challenges of SAPs. They can assist with team collaboration and communication, with project efficiency. They can help to increase public trust in science, with reproducibility, and increasingly with regulatory and journal compliance and policies. There are sufficient drawbacks to be aware of, however. They can be exceptionally time and resource intensive. There's a lack of guidance in preparing them. Real-world research requires flexibility, and and Olken does a very good job of explaining this in his paper, where it's practically impossible and burdensome to pre-specify and anticipate all influences on statistical analysis. And it takes me less than a minute to think from my own experience of all the different examples where it would have been administratively very difficult to prepare an SAP and revise it all while trying to also manage, simultaneously working on 10 studies to get them to completion and publication. Like examples of under recruitment, I've had student trainees incorrectly put their primary outcome measure on Qualtrics, so they didn't get their primary outcome data, unexpected variable distributions, PIs unilaterally deciding to withdraw participants from the analysis despite it being an intention to treat analysis that was specified in line with best practice. I've just recently seen changed lab procedures regarding analytic pipelines. So the whole pipeline for a particular calculation of polygenic risk scores changed. New analytic techniques, like for polygenic risk scores, became available. New research questions are often suggested by the clinical team during the study and analysis when you present first versions of results. Recently, investigators will redefine particular variables during the course of the study, particularly gender and racial ethnicity, as best practices for these kinds of matters advance. Another challenge is that there can be a lack of shared philosophy, so not all research team members may understand the value of SAPs, making implementation challenging. So I just shared the example of a PI who wasn't too familiar with, following the pre-specified analytic plan and the purpose of the intention to treat analysis. So that can be difficult if not all team members have that statistical background and understand the value of the analysis plan. There's also can be an over focus in, I guess, the public zeitgeist on scientific misconduct. And the way this has been addressed to help prevent misconduct is imposing these increasingly more complex administrative burdens on researchers. There's many initiatives beyond the statistical analysis plans. And as Olken highlights, if we were to limit research to pre-specified analyses, then this could risk curtailing scientific discoveries that may have important public impact. So let's now turn to the landscape and future outlook of SAPs. Adoption of SAPs varies by discipline, by sectors, so industry versus academia, and study types. They're most commonly used for clinical trials, which are more regulated. So they're currently mandated, for example, for NIH-sponsored trials. So they need to be deposited either within the study protocol or as a standalone document onto clinicaltrials.gov. And they are also mandated by regulatory agencies, such as in the US, the FDA, and so on. So there is more regulation for clinical trials. Journals as well are increasingly calling for pre-registration of both study protocols and SAPs, and including for observational studies. And some journals have released editorials on this or put specific guidelines on their websites. Increasingly, I'm seeing that studies that I work with, like biobanks, consortium studies, and large cohort studies, such as birth cohort or pregnancy cohort studies, require SAPs for data access. And some labs operate with policies for pre-registration and SAPs before analysis. So I've also seen that being increasingly implemented. Overall, outside of regulated trials, SAPs are mostly voluntary, but they align with broader efforts to enhance rigor, transparency, and reproducibility. And this figure here illustrates how study protocols are being increasingly registered. And SAPs are lagging behind this trend of study protocols, but presumably follow a similar pattern. So as awareness increases, the adoption of SAPs is likely to rise. So before we conclude, I would like to take a moment to acknowledge the scholars whose work informed my presentation and SAP template. Also to reintroduce myself, I'm Hannah Watson. I'm a Research Associate Professor at University of North Carolina. My slides are available at this link if you'd like further information. The SAP template is also available at this link and through these QR codes. I'd like to acknowledge funding through NIMH, through PI Cynthia Bulick. And lastly, I'd also like to thank you for attending this talk today, and especially to thank the Caucus for Women in Statistics and Data Science for hosting this incredible event and inviting me to present this talk today. So thank you for your attention. I hope you have a great rest of your day. There may be questions, but I'm aware that a keynote is next. I'm happy to take any questions, but otherwise, I hope you enjoy the keynote talk coming next and the rest of this event. Thank you very much.
Thank you very much, Hannah. We have one question, and I think we would have time for that one. Thank you.
Sure.
And so it's in the chat. Someone asks, what's your opinion on the credibility of SAP submissions for publication after the main study has been published? This person notes that they've encountered this several times now in the published literature.
I'm not familiar with that myself. I think the point behind SAPs is to pre-specify the analytic plans, and in either one of the editorials I was looking at or the guidelines on the journal, it was specifically saying that it wanted the SAP that was prospectively developed, so before the analyses were conducted, to be submitted. So yeah, I don't think that's in line with, it's not in line with current best practice. So yeah, I can't really comment much beyond that.
Excellent. Thank you very much. And again, one more time to celebrate and to thank Hannah for her presentation. Thank you all.